face and we're working on those muscles, we ask our patients to go prunes, prunes. Right, so you get a really big O and it really works the orbicularis oris. Ooh, prunes, like that.
Yes, we are on air.
Oh,
Wonderful.
hello everybody, this is Shirley Gutkowski for the Spot for Health, letting Sun Prairie know where to go for healthcare. And we are back online and back in the studio here at K-Sun in Sun Prairie, attached onto the Sun Prairie Library. We are going to be, we have a little list of shows to bring you so we can get you up to speed and get you interested to know more about some of the healthy options you have here in Sun Prairie. One of the things is obviously our practice here in Sun Prairie on Main Street called Primal Air, and we've got a little promotion going right now for our Buteyko breathing classes, which start on March 13th. So if you'd like to know more about that, you can just go to our website, primalair.com. And in the meantime, one of the things that Buteyko breathing does and helps you with is with anxiety. So we wanted to have a show about some of the options that you have for anxiety right here in Sun Prairie, including what we do at Primal Air. And I was talking to Lori here at Wisconsin Dental Solutions. Hi, Lori.
Hello there.
And she goes, well, I have like almost a whole program that I've studied up on to help our patients with anxiety in the dental office. So that's what we talked about. So Lori Sherman is the dental hygienist over at Wisconsin Dental Solutions. What's your address?
1260 West Main Street.
1260 West Main. So we share a parking lot.
We do.
And she has been you've been at that location yourself for over a decade.
16 years.
16 years. So it's been quite some time. And now you are with Dr. Latowski.
Correct.
And you have been practicing in general, though, for 35 years.
I have.
And it looks like you've got a lot of interest in holistic kind of practice.
I do.
You yourself. So you know more about nutrition than maybe the average hygienist, because I think what happens in a lot of practices is that they just talk about getting off of sugar, getting off of sugar, getting off of sugar, which is going to have to be part of the story, but there's more to it than that. And you've also studied up on motivational interviewing so that you can get to the bottom of it. And you've also worked with Eckhart Tolle, or
No, just studied.
just studied his material, his work, and Wayne Dyer. And you have postgraduate studies in a number of things, including nutrition and alternative modalities.
Correct.
Modalities to what?
Health, wellness. It's the name of the game.
Not just eat your carrots and then call it a day. And there's,
it's all connected.
it's crazy, right? The more I look
love
at
it.
it, the more I'm like, wow, I don't know that we've been doing everything right. It's this last little bit with sugar and how sugar has bought some scientists back in the 70s and all of that whole thing. I would encourage everybody to look that up, because that's a story. They're going to make a movie out of that one, I'm sure.
That'd be great.
It would really be great. So what kind of things do you do for anxiety? So sugar has been tied to creating anxious behaviors or increasing anxiety in some people. So that's a little bit of a part of the story, but there's other things that we can do for anxiety.
Absolutely. There's such a wide variety of things. There are things that your practitioner can offer within their office, things that might be helping you as far as medications or the nitrous oxide, or even an IV sedation. So that's
pretty drastic.
one whole. It is.
But some
It
people
is.
need that,
Yes.
especially when they have to have dental care done.
Absolutely. So that's the end game. If you're extreme anxiety and fear, there are options for you. And we offer those within our practice also. I think it is important to pursue and research and ask around for referrals to your friends and family as to who's doing what and who's going to address the issues that you have and that you're interested in. It's not a one-size-fits-all game. And so I think it is important to ask around and see who you think is going to be the best fit for you. And so other anxiety things that you can, that I work with patients on is I offer them ideas and suggestions as far as things they can do at home. And today I'll be talking about mindful attitudes that they can adopt and practice and learn themselves. And then in addition to that, you could have another whole program on physical things that they can do, such as learning meditation or yoga, tai chi, and exercise, and all these other things that you can utilize to help minimize your anxiety.
The home piece is important even if they're fearful in the dental kind of a conversation. So even if they do sign up or they do need to have IV sedation in the dental practice, it takes some oomph to get yourself even to that level. So let's talk a little bit about some of the things, the 10 things that we can do based on your studies.
Yes, and as I understand it, we're going to do a two-part series.
Yep.
And so we'll cover the first half, and then there'll be another session that we can cover the other half, so people know to tune in for both.
That's right. Gotta come back.
So the first attitude that I like to talk about is intention or volition, which kind of that's the whole basis of everything. We're going to start our plan. We're going to direct our brain. You make an intention that, yes, I understand I have anxiety and this is going to be difficult, and my plan is to do what I can to make it better. So whatever you focus on is what your brain is attracted and focuses on. And it's spinning its little wheels as we're sleeping, as we're working.
Because you talk yourself into this like negative circle, right?
Yes.
It's going to be bad. I'm going to spend a lot of money. It's going to hurt. It's not going to work anyway. I know 3 people that it didn't work for. And this whole self-talk thing, I've seen people go through that. You can just watch their head go, and you can see it's negative.
It does, and it just spirals, and it grows, and it grows, and it's not helpful, it's not productive. So there's so many simple things, little tips, that if you just practice them, you'll be so amazed at how well they work. So I love it, and when I'm working with patients, I give ideas and suggestions. You plant that seed, you encourage some practice, and I love seeing from start to finish. You start with a patient, and they're pretty white-knuckled and upset and concerned at first, and then, you know, after a couple appointments later, they're coming in, and you know, don't tell anyone, but I actually like coming to the dentist, or I look forward to it because they've formed relationships, they've earned their trust, and they've learned how to manage themselves better. There's so much you can do for yourself.
And with proper planning from the treatment side, I think there are opportunities to hold back a little bit just for ease of mind kind of thing. I mean, if you're getting a tooth extracted, there's really, once the dentist is in there, you've really kind of committed. But there are places in normal, less drastic treatment opportunities where the patient can say, hold on, we're going to have to stop or put it off, or...
Yes.
Yeah.
Yes, you don't want to get stuck in that position.
Right.
And so this is the beauty of getting started with the intention, directing your brain, paying attention to the words that you say to yourself. You had mentioned the self-talk. Positive self-talk. Practice it, practice it, practice it. There's even suggestions. Look in the mirror. Practice yourself before you come to your appointment. Look in it, tell yourself you're confident, you can get through this, you understand it, you get it, and it just helps. It helps build. It builds each layer on itself so that you gain more confidence.
So what happens after volition?
After volition, we're going to talk about adopting a beginner's mind. So we all have these stories from our past that we've learned. So we've created a story on what our old experiences are. The thing that we need to practice and remember is that that is the past, and we can let go of the past. We don't have to keep rewriting, retelling that same story, and we can create a new story. So let's have a beginner's mind. Let's be curious. Let's pay attention to what's going on. Let's create a new story that we can build upon. Success. We're going to focus for success.
Right. So this is going to be like your beginner mind as a patient at the practice, or a beginner's mind doing whatever it is that's new and different.
Correct.
So do you help people get to that point, or how does that work, or is it just like part of your secret sauce that happens personally?
Well, part of it is if a patient will tell me that they've had a bad experience or something that was difficult for them, such as x-rays. I hate x-rays. They're so difficult. I gag, I choke, I throw up.
Right,
All these
and they're
different
driving
things.
the whole time going, oh my God, I hope she doesn't have to do x-rays, yada, yada, yada. So yeah,
Yes.
there's that negative self-talk.
Absolutely, and they're planning for the worst to happen again. And so I thank them. I appreciate. It's good for me as a practitioner to understand and know what their past experience is. And then I ask for the opportunity. So let's say we could try something different to make it a different experience for you. I think that we could do better than that. So I have some different tricks that I'll try, and we talk through it, and usually it goes beautifully. And then I'll stop and ask, check in, so how was that for you? And they'll say, not bad at all. It's
Right.
nothing like it used to be. And I said, so then I really want to lock it in. Okay, so this is a new story.
There you go.
Lock it in. Remember, repeat to yourself, next time when you come, you're not going to have to dread the x-rays again. You know, you've experienced, it's a better experience.
So how would you say that? Did you activate the beginner's mind, or did you motivate the patient to recognize a beginner's mind, or how would you use that phrase right there?
I usually don't even use the beginner's mind term
yes,
with
but
them.
in yourself, for
But
your own
absolutely,
purposes, yeah.
just like I had said, I'll present the situation. I'll offer a new story. I said that's your past. It doesn't have to be your present or your future. Let's create a new one, and then we proceed from there. And they really kind of connect with that, and then you can tell through the appointment they keep thinking about. Oh, that wasn't
Yes,
bad.
that
and,
wasn't bad.
Yes.
And if you point out that this is a new starting point, then that really kind of does solidify the whole idea right in your head. So what comes after the beginner's mind?
Well, it takes patience, lots of patience. A person, when they're used to anxious, scary, frightened experiences that they've had in the past, they tend to also beat themselves up about it. And so I ask them to have patience with themselves first. You know, so it's really important to give yourself a chance to understand that you probably had a good reason for being upset and whatever emotions you were going through in the past. There was a good reason for that. And understand that it can be different. So let's take a breath, and hopefully your practitioner is with you and understands and takes it slow and gives you the time to walk through it. And like as I'm working with a patient, what I'll do is with a patient's section is basically I want to take it slowly and let them know everything that I'm doing. In essence, I even sometimes will ask their permission. Okay, it's okay if I lay you back now, because that will trigger a bundle for some of them. You know, all of a sudden, whereas if I ask their permission and I ask them how far I can go, it's important to let them have some control of the situation, that this isn't all being done to them. We're a partner in this, and we're going to do it together. And that really helps kind of build that trust together.
So all that patience takes time.
Yes, it does.
So you, at your practice, have an extended amount of time with your patients.
I do.
So is that to accommodate this kind of anxiety or these levels of fear? Do you shorten up the appointments, or how does that work? Because a lot of hygienists are really on a tight clock and they have to twitch to get ready on time. When I'm in those situations, I just stop everything and I take care of the patient. And I'm bad about asking permission. I'm really bad about that. I'm like, they figured out, lean them back. But when there is an anxiety-ridden, you know, that's been a long time, or they don't know, or something else happened, I don't do we just don't do the appointment. We talk and we get to know one another, and I allay fears and I talk with them, and maybe all I do is an oral cancer screening, and just that's it, and then they leave and go home, and they'll have to come back for that in most situations. I've noticed that dentists that have hygienists that do practice that way don't seem to get really mad about that. They are okay with that, but it's hard to ask people to come back then. But most will if you take the time out to really talk with them. In your practice, you have as much time as you need, though, right?
I do. I've already spent over 2 hours with some people
Really?
to get a basic cleaning done due to their anxiety level. And yeah, so what I try to do is I will tailor the times according to what's needed for each patient. I mean, I would say my average common time is 1 hour and 20 minutes.
Wow.
And it's wonderful, and truthfully, even if things are going smoothly and well, there are so many things you can use. If I'm not using that time to help someone with their anxiety, I'm using it to teach some oral hygiene, or to talk about their nutrition, or their overall health and wellness. So it's a very holistic approach from that standpoint.
That's really awesome, and it's not usual enough. I belong to a lot of Facebook groups and with dental hygienists, and they're always talking about having 45 minutes, and now somebody wants to cut them down to 30 minutes. And you can't get really good care in that amount of time. Yes, you might have most of your teeth scraped, but that's pretty much it. So patience needs to come from the patient themselves, or the client.
Absolutely.
And from the clinician. And how does rolling your eyes as a clinician affect an anxiety-ridden patient? It's not a good practice, am I right?
Oh, big no-no. You know, sometimes I will actually put my hand on their shoulder to try and help ground them, hold their hand, or I'll sit them up and sit knee to knee with them and talk things over. And some of them feel the need to, some of them cry, telling their story, and it's okay. Let them. They need to go through this to get to the other side. And there have been some really, really difficult times that we've been through, and it's so rewarding to come out on the other side and you've changed someone's life, that they can do this again, and they've created a new story.
That's awesome. That's really awesome that you're afforded that amount of time to allow for patience for you, that you're not like, oh my God, I'm running out of time, and for the patient.
Well, even like you had said, sometimes, even with the amount of time I've given, sometimes I'll have to reappoint.
Yeah.
I did a couple things and I'm out of time already.
Yeah, right.
It goes quickly.
Yeah.
It goes quickly. And I've had patients who've come in, you're going to take how long? You know, and they're rather taken aback.
They're used to the 30 minutes and not having.
And they've gotten used to this run life.
Yeah.
Run life. And they're on this treadmill and this go. And then once they've experienced it, it's like, oh, you know, it's something new, and it's like, oh, that's a lot different. I like that.
So acknowledging the patient's fear is a part of this. Am I right? I mean, you're not just going, it'll be fine. Just open your mouth and turn towards me and it'll all be great. Believe me.
Yeah. That's a quick way to lose a patient.
Yeah.
A quick way to lose a patient. So yes, I want to acknowledge, and truthfully, watching their body language through the whole appointment. I check in, I check in, I check in. How are you doing? Is the chair position okay? Is the temperature okay in the room? I'll offer them a blanket. You know, are you sensitive to lights? There are so many different things in their local geography that you can help to, some people you put a blanket on them and it's like, that makes a world of difference. They're ready to sleep.
Yeah.
And it's like, yay, go ahead. I've had people fall asleep during their dental appointments, snoring and all, snoring loudly. And it's great.
Yeah.
I don't mind. I don't mind. You know what? That's a sign.
Yes.
Perhaps they need to see you.
They do need to see me.
Number
then. Yeah,
one.
thank you for that.
They might have some breathing issues or sleep apnea or
Right.
something. But other than
But
that,
it does let you know as a practitioner that they are accepting of you and your treatment and they feel safe in your hands.
yes.
It's hard to sleep unless you're a tiny infant when
It
somebody is causing anxiety and stress.
Yes. And I also, when I'm asking them how they're doing, I want to encourage them to ask for what they need.
Oh.
So I want to teach them that it's okay, as someone who has anxiety, if they need a break, raise your hand and tell me, I need a break. I need to sit up a minute, or I need a drink of water, or whatever it is they need. I want to help them through that anxiety. And so I make it A-okay. Always stop and ask, let me know what you need. I'll try to check in, but I can't mind read everything.
Right.
And I'm open. I'm way open to ideas and suggestions, and that's part of the learning. I love it. I learn something new from people all the time, even after that many years.
Yeah, everybody's got a little story in there, crazy or otherwise, right?
It is. And even, I don't care how crazy the story gets, there's usually some way that you can connect and understand. It's like we've all had such similar experiences in some way or another. It's like we share similar stories, and so that's helpful to acknowledge also.
Right. So what we do is we kind of work with breathing at our practice to teach people. Yeah,
Huge.
it's huge, right? And so there's a completely different way of breathing that can reduce anxiety over time. So do you do any breathing techniques at your practice too?
I stick with a pretty basic, teaching them to belly breathe.
Oh, okay.
I want them to, because they tend to knot up and start breathing from their chest, and it gets shallow. And typically when people expand that into their belly, they can initiate a relaxation response. And it'll help kind of get the whole body to start not hyperventilating and
Yeah, well, it motivates an entirely different nervous system when you're breathing appropriately.
yes, yes.
So, let's see. Then we have this, along the same lines, this crazy hygienist that only has 30 minutes and the patient this is the story I see on the Facebook groups a lot. They can't have saliva in their mouth. And then the patient thinks they're drowning. It's their own saliva.
Yes, they do.
You don't know that they may have been traumatized in some way where they have this choking feeling.
That's correct.
And these hygienists are all twitched up because now they have to stop and get the suction out. So that can be, it's judgy, and it's not helpful to the situation.
I completely agree.
I feel like I'm throwing everybody under the bus. I'm going to get so much hate mail.
Well, I can understand, and we can tease and make
Yes.
fun of, you know, and hopefully of each other more so than others. If we were to put ourselves as a practitioner in their shoes to try and understand and have some compassion and empathy where they're coming from, then it's so much easier to try and be non-judgmental and realize that there is a really good reason for this if you only knew the story.
Right.
If you only knew the story. So I ask, I try and get patients to realize sometimes they'll even judge themselves. I had a patient come in lately who was just ranting about what a terrible person she is.
Really?
Yeah, I'm a failure.
Oh.
I don't do this. I don't do that. I'm just a mess, and on and on and on. And I had to stop her, and I said, do you remember how important words are? Words are really important. And from my standpoint, I see what a successful parent you are. You are so dedicated to your work, and you do all these other things so well. And I know that if you had the time and resources, you'd be a master at this also. So let's agree that in time, of course, when things change, you'll just get better and better. So I'm totally fine waiting and being patient for when you're ready. And I'll help you and hold your hand along the way. And anything you need, I'll try and come up with ideas and suggestions to try and be creative. How will you squeeze this in or make that work? But beating yourself up won't work.
It won't work. And you don't need to know what their story is unless they want to share it with you. You just have to know that there is a story.
Yes.
And you have to treat them as if there is a story.
Simple.
It really is that simple.
It is. Because there is always a story. You can just know that.
Yeah.
You don't have to know all the stories. It'll take
That will
eons.
take a long time.
It definitely
lead
could.
Parallel lives, and you just keep going, run right after another.
Well, and people, not everyone's comfortable sharing their story.
Right.
We don't need to go there. We don't.
No, but we have to know that there is a story, and that they're reacting to their story. They're not reacting to you, the clinician, necessarily.
It's not personal.
Yes.
It's not personal.
So we don't judge them, and we don't judge ourselves based on their reaction, right?
Yes. Yes.
Simple pimple.
Serve them. We're there to serve them.
Yes.
And that's how we can help with their anxiety, is by serving them the best that we can.
Excellent. Thank you, Lori, for part one of dealing with our patients that have anxiety. We are going to just kind of close up here. Your office again is at what location?
1260 West Main Street.
So, and it's super
Sun
duper
Prairie.
easy to find, and we're in the building right behind them.
She is. We're so close.
We're so close. We share a parking lot. And so this is the end of this edition of The Spot for Health. My name is Shirley Gutkowski. You can find us at Primal Air. Our phone number is 608-318-2800 if you'd like to know more about our breathing classes, or if you have any other issues with your mouth and breathing. And in the meantime, check back here, share these episodes from the internet. This is Shirley Gutkowski signing off for The Spot for Health, the place to go for health in Sun Prairie.